Assalamu alaikum and welcome to Medicour on IQRA TV. My name is Rabina Mir, and today the topic that we're going to discuss with my guest is skin, lumps and bumps. In the hot seat today we've got Dr. Gordon Sinclair. Welcome, Gordon.
Hello, Rabina.
You're a GP from Leeds. You've been practicing for 24 years by the sound of it, yes?
That's correct.
And you're also involved with the Clinical Commissioning Group in Leeds as well, which is about purchasing NHS services and making those decisions. So I really appreciate you taking the time to come and join us today.
Delighted to be here.
Yeah, lovely to see you. So the topic is skin, lumps and bumps, which is all those things that can come up that we maybe don't take too seriously, but we need to think about in terms of why we should see a doctor and why we maybe don't have to see a doctor. Yes. So I guess what I should ask you first as a doctor is, what kind of problems do you see as a GP that are related to the skin?
Well, as a GP, we see lots and lots of problems related to skin. It's one of the probably the commonest presentations that people bring to us is problems with their skin.
It's a vast area, isn't it?
And yeah, when we think about it, it's a very visible part of the body, and people see things. Obviously, we can't see our internal organs and structures, but we see the skin every day. Just looking in the mirror is part of that. So what I really wanted to focus on today is those problems where you get specific bits of the skin that perhaps have changed or look different to people. So we're not going to be talking about rashes or long-term problems with the skin like eczema, but it's those lumps, bumps and funny areas that people get concerned about. Yeah,
I know later on one of the things we will cover is about skin cancer as well, because that's something that can start off as something that you might not think is serious. Yep. But we're also going to talk about the less serious things as well.
Yes, and I'd probably highlight that most things that we see as a GP are not serious. Yeah. And often it's about reassuring people that it isn't serious and that they don't need anything doing, or they can look after these things themselves.
I know there's lots of things that we sort of put up with, don't we? You know, we sort of think, oh, it'll go away, I'll treat it at home, and probably that's the best way forward a lot of the time, but it is about understanding the difference, isn't it?
Absolutely.
Okay.
Yes.
So you've got a lovely picture here of the skin.
Yes.
Well, it's an internal picture of the skin. What can you tell us about this?
Yeah, so this is quite a blown up picture of the anatomy of the skin. So if we think this whole bit here is the depth of the skin, and down here we've got the fatty layer. So everybody has fat that sits under the skin, whether you're thin or more fat. Everybody has that fatty layer, and that's kind of like an insulating layer. And then we've got the structures that enable the skin to do what it is. And if we think about the skin, it's an amazing piece of the body. It's the biggest organ in effect in the body. We can think of it as an organ. It serves lots of functions. As we know, it's amazingly strong. It resists all sorts of damage.
Waterproof.
It's waterproof. It's very flexible.
It is.
So it allows everything to move while still protecting you. It keeps us warm when it's cold.
Yep.
It keeps us cool when it's warm. And it also delivers all or some of the senses related to touch, pressure, vibration. Right. So if we didn't have the things that are in the skin, we wouldn't know whether we were burning our fingers, for instance. So all those sort of sensors like that, which allow the body to protect itself. It's quite a detailed picture. The obvious thing is the hair here, which as we can see is bedded down deep in the skin. This is the hair follicle, which we have, and we have those everywhere in the skin. Obviously we know most of them, a lot of them are on the head, but we know all the other hair-bearing areas. But actually you have these everywhere. So we might come back to the picture later on when we're discussing specific problems with the skin. Okay.
One of the things that people worry about on the skin are warts. What's a wart?
So a wart is a small lump on the skin, which is caused by a viral infection. So they're very, very common. It's almost probably that most people will have a wart. The vast majority of people will have a wart at some point in their life.
And it can be any part of the body?
It can be any part of the body. It's most common in those areas where we get more contact, because it is passed by contact. The virus is passed by contact. So the commonest place is probably the hand. So fingers and they're obvious small lumps on the fingers or the hands or other parts of the body.
So what do they look like? How would we recognise a wart?
So they're usually quite small, maybe up to 4 or 5 millimetres in diameter, sometimes smaller than that. They have a sort of, usually they'll have a sort of slightly surface frond-like appearance, so they've got like little fronds on the surface. That would be a typical wart. Fingery things, yeah.
Okay.
That's not always the case, and sometimes they just look slightly scaly on the surface.
But they're not smooth.
But they don't tend to be smooth. No, they're not smooth.
I think the ones I've seen on people, they look hard. I've never wanted to really touch one, but they don't look like they're a soft thing. Yeah, they do. Yeah, they do. They have a firmer appearance, or if they're frondly, those can be slightly movable. Okay. So the virus, for whatever reason, it attacks the skin and it causes that problem in that area. In most cases, the warts will be self-limiting. By that I mean that if you leave them alone, they will eventually disappear under their own steam. And how long is that then?
Now, but that's the issue, because that can vary from a few weeks. Sometimes people have warts for a year or even a couple of years.
That's what I was wondering.
So that can be the case. So I think the reason why people come to us is to say, well, is this definitely a wart, because it's not going. Yeah. So to make sure it's not something else. And also to see, is there anything that they can do to get rid of it?
They're not the prettiest things, are they?
No, they're not. They're not. So it depends where you have them.
And I guess, when I think about it in the terms of when I was growing up, at school we used to sort of think, you don't want to touch a wart, it doesn't look particularly pretty. And then there's a worry, of course, of getting it yourself. So if I did have a wart, how would I make sure that I wasn't passing that virus on to other people, or could I do anything to protect others as well as not get more?
Yeah, so warts on the hands, it's quite difficult. We use our hands all the time. We're always touching things. Even opening a door, you're touching a door handle. So you cannot absolutely stop that contact. So the likelihood of passing between people is more in a household situation where you're coming into regular contact with the same person. We probably see warts most in children and young people, but children particularly, because they're always close together, playing, etc. And I think also as we get older, we build up resistance to the wart virus, so you're less likely to get it in older age. So I think just if you have obvious warts, just being aware that they could possibly be contagious to other people by direct contact. So minimising that contact. So
if somebody came to see you with the wart, what's the treatment plan for that?
Well, what I'd probably first of all do is say, check it out, is a wart. Say, what have you done already? Yeah. Most of the remedies for warts are things that you can get yourself from the chemist. Okay. What we prescribe in general practice is basically the same stuff as you can get in the chemist. Right. So common things people have probably heard of, bazooka, that sort of thing. It's
I know the brand names exist.
Yeah,
as well,
so it's an acid-based substance which basically damages the wart area, and slowly over time it allows it to settle back down. So there is evidence to suggest that using that can speed up the resolution of a wart. Okay. There is not a huge amount of evidence for any other treatment being better than that. Okay. People have tried all sorts of things. Yeah, yeah. Another thing, there's old-fashioned remedies, and I think it probably just demonstrates that warts generally get better. So some of the things that people try will coincide with the wart getting better, so they'll think it's what they've done that's cured it. Yeah.
What I didn't ask you is if they hurt.
Yeah, so if you have a really troublesome wart that is causing a lot of pain in a really awkward place, or bleeds or is getting recurrently damaged, you could consider something like freezing the wart. Right. If it's a biggish wart, that would need a referral to a dermatologist or a specialist to do that. GPs might be able to do that depending whether they have the facilities and the expertise to do that.
Okay, that sounds really helpful. Anything else you want to tell us before we move on?
I don't think anything else specifically about warts. Okay. No.
Just get reassurance from your doctor that it will go away eventually.
Yes. So and don't worry about it.
Easier said than done. Okay, let's talk about the next thing, which I remember from being at school and going to the swimming bath, verrucas.
Verrucas, yes. So verrucas basically are the same thing as a wart, except it's on the foot. So verrucas tend to be on the sole of the foot, so they're underneath. So if you think about a wart on the hand sticks out from the skin, on the sole of the foot, because you're on your feet and you press, the wart gets pressed into the foot. So it doesn't stick out, it gets pushed in.
So it's another type of wart.
So it's basically the same thing. It's just a bit more tricky to deal with because it's not exposed, it's internal. So getting things in to treat it or things on it to treat it just can be a bit more troublesome. The same advice applies. Verrucas will go away generally spontaneously given enough time. But we do know that some people get painful ones if they're on a real pressure point or something like that on the foot. So again, you can try the acid-based treatments like the Bazooka. There are other brands available. And your GP could also prescribe those.
And what's the association with the swimming bath? Is it just because that's where people often walk around with the virus?
Yes, so people are walking around in bare feet, and it's probably the environment, it's damp, it's warm, it's an environment probably where the infection's more likely to occur. So people say, if you've got verruca, should you go swimming? Sometimes I kind of almost take the opposite tack. If you haven't got a verruca, maybe you shouldn't go swimming. They're so I'm not suggesting that, actually. I think everybody should go swimming. But basically, it's potluck whether you get them or not.
I remember at school they used to stop us if we knew we had one. And I guess but it's like you say, if you haven't got one, you've got a high chance of picking one.
But learning to swim for children, particularly, learning to swim is much more important than worrying about.
So is there something we could do to our feet before and after swimming that would perhaps protect us from picking up a verruca?
I don't think there's any evidence suggests there's anything specifically you can do. People used to wear verruca socks. There's sort of plastic things you could put on your feet to stop transmission. They're not particularly recommended, but I guess if you had a lot of verrucas, it might be worth considering that. The other thing I didn't say about warts, and I'll say now with verrucas, if you are treating with the acid-based gels, it's really important that you follow the instructions closely. Part of the trick is, and particularly with verrucas, you need to take off the top layer of the verruca.
Oh, do you?
Where it's hard and a bit scaly. So you need to use something like an emery board, or nail file, or a pumice stone. People still sometimes have that, and just scrape down the top surface and then put the gel on.
And that's to make it absorb better, is that?
Yeah, it's just because the top layer will resist it more. So you're trying to expose the next bit underneath. So you rub it down and do that. And but you need to do that every day. Usually for several weeks.
And not use the same implement on anybody else.
No. So you need to be quite diligent with it. It's not something that, I'll stick it on once or twice and it'll go.
There's a course like antibiotic.
Consistent use.
That's really helpful to know because I'm not sure I knew that. So thank you for sharing that. What are sebaceous cysts? That's on my list. I don't even know if I'm pronouncing this correctly.
Yeah, no. So sebaceous cysts. So we can refer to the chart. So I don't know whether the camera can pick this up. We have
zooming in on this camera.
There's a gland here called the sebaceous gland, which, as you can see, is next to the hair here, and it actually secretes an oily substance called sebum. And that goes up the hair and onto the surface of the skin, and that helps, in effect, lubricate and keep the skin healthy. It's a natural thing. It's a sort of greasy substance. So, but sometimes what can happen is the outlet from the gland gets blocked somewhere around here. So the gland continues to create the sebum, and it basically backs up. So the whole
like
area around
jam of stuff.
So it can't get out, so it just backs up and it grows and grows and it forms a cyst. That's what a cyst is.
Is that going to be painful?
So it's not usually painful, but people suddenly notice or notice over a period of time they develop a slightly softish lump. They're probably the commonest on the scalp. I would say that's where we see most of them. They're quite common on the back as well.
Okay.
So they're
any particular reason why they're more common there?
I don't know actually.
Okay.
I don't think there's any particular reason. But what we do see is some people get multiple ones.
Okay.
They just seem to be prone to them.
Okay.
We don't know why. So I've seen people and they come and they have them removed every so often, and they just generate new ones.
So we're not linking any of this to hygiene issues or anything like that?
No. It's I don't think there's anything particularly that people can do to prevent them coming.
Okay.
They're just things that develop.
Okay.
So the features which I think is important to highlight for people is they're usually slightly soft. They can have a firmish feel, but they're usually slightly soft. You can sort of press them a bit, and nice and smooth.
Okay.
And people, it can cause a bit of discomfort, or people are just unhappy with the appearance of them.
Yeah.
Occasionally they can get infected.
Right.
In which case they become painful. They tend to enlarge and become red and angry. Sometimes they can then discharge, or they leak pus.
Yeah. Okay.
Or they can rupture.
It's a great topic for tea time viewing.
It is.
I hope nobody's eating any custard or anything at the moment.
So they're quite benign. They don't cause any problem. They don't usually sort of resolve themselves. They'll just get to a size and they'll sit there.
Okay.
So they can be removed surgically.
Yeah.
So you just cut over them and take them out.
That sounds quite serious. That they have to come and have them removed. They can't.
Well, they don't have to. That would be up to the individual whether they wanted to have that done.
Okay.
You can live with them. They're not going to.
Are they going to go away eventually, or is it something that?
It's possible, but most of them won't. They'll
Okay.
they'll just sit there and have a little lump under the skin. So most people, if it's uncomfortable enough or it's unsightly enough, they'll want to have them removed.
All right. So again, this is something that they might come and speak to a doctor about, and
Yeah.
you'd have to look at the individual situation
Yeah.
to decide what's best for them.
So I think for me that I mean, there's the different parts of the skin where we can get problems. So
Yeah.
we talked about warts and verrucas, which
Yeah.
are kind of on the surface of
Yes.
the skin. These lumps, like sebaceous cysts, occurred. They're not visible on the surface. They're sort of sebaceous cysts are within the skin,
Yeah.
but they cause a lump. But there are other lumps which kind of appear under the skin.
Okay.
Vast majority of them are benign, and the two common ones are sebaceous cysts.
Benign meaning they're not serious.
Benign meaning they're not serious. They're
Yeah.
not going to cause any other problem with your health. They're not going to do any damage to
Okay.
you. The other common one is what we call a lipoma.
Okay. Not
So
heard that before.
Lipoma is lipid means is relating to the fat.
Fat. Right.
So that's a lump arising from the fat, and that's
So much deeper it's coming from.
yeah, and a benign collection of fatty cells which just forms a lump. It can feel similar to a sebaceous cyst, and again can be removed, but you're best to seek advice from your GP on that. You can get other lumps under the skin, things like glands, lymph glands that swell up and down. And if you're concerned about a lump under the skin, then I think it's a new lump under the skin. I think it's important you do go to see your doctor, just to make sure we rule out it's nothing else and more serious. Most of what we see is these.
Yeah. So it's not wasting a doctor's
benign
time to come
things.
and check them out then?
No.
In fact, it sounds like you're
Absolutely not.
encouraging
Yeah.
that. Yeah. Okay. That's good to hear. Thank you. Okay, I guess one of the things I should talk to you about is about the more serious things. These are obviously things that can be irritable and sort of, not sightly, but they're not under the serious category.
Yeah.
When we look at serious situations, we often think about skin cancer, don't we? So before we go into that, I guess what I wanted to ask you is, what can we do generically to look after our skin? What would you encourage people to do to look after their skin anyway?
The skin is good at looking after itself, generally,
sounds like it,
and unless we do things to it that might cause it to be irritated or be affected. So the typical things are overexposure to sunlight.
Okay.
We all know about or most people are aware of sunburn if we're out in the sun too long. I think, so that's to be avoided. Keeping your general body condition healthy, so keeping hydrated.
Okay, so that's drinking plenty of water.
So that's drinking plenty of fluids. The skin gets its fluid from what we drink, the same as every other part of the body.
So we're not just talking about water, we're just talking about fluids.
Yeah, fluid. Well, water essentially is the main bit which will keep it hydrated. Having a healthy diet.
Which is a controversial subject of what everybody interprets that as.
So if we think about the 5 a day kind of thing, eating a mixed diet, fruit, vegetables, that's where you're going to get your vitamins from, which... Yeah.
So that rainbow of colours of fruits,
all of which contribute to a healthy body, part of which is the skin.
So we're not just eating beige food, we're eating all the rainbow colours of food.
Absolutely, that's a really good way to put it, I think. So a healthy diet. I think one thing we do know adversely affects skin is smoking.
Right, that comes up a lot now, subjects a lot of the time.
Yeah, so there's a definite relationship between smoking and wrinkle development, for instance.
Right.
We know that smokers are much more likely to develop wrinkles.
So they're going to look older earlier.
They're going to look older earlier.
Right.
Particularly on the facial area.
Okay.
So as a GP, I wouldn't be sensible for me to say to anyone without saying you shouldn't smoke.
Yeah. Can passive smoking have a similar effect if you're around people that smoke?
Yeah, well, I think passive smoking, you'd have to smoke. You'd have to be exposed to a fair degree of it. But
there's a lot of changes happening within the smokers' world, isn't it? I mean, in our communities, lots of people are going into shisha bars, and I know you may not particularly know something about that, but the risk factors for those are apparently just as high as what you're inhaling around those people. So I guess it's one of the things that we need to look into. But certainly, like you say, smoking is going to have an impact on the quality of the skin and the fact that it'll age quicker.
Definitely, yes. I think that's
all the other problems we know about with smoking.
It's just another thing to add to people, another reason why you shouldn't smoke.
Yeah. Okay. What else can we do to look after our skin? Moisturising? So
moisturising is good if you have particularly dry skin, or if you do things with your skin which make it more likely to be dry. By that I mean it might be certain occupations where, for instance, you work in a certain environment, dry environments, sometimes air-conditioned environments can dry out, or if you, for instance, with your hands you have them in water a lot, or chemicals less likely because you're likely to wear protective equipment. But
a lot of our mums at home, they've got very traditional habits of using bleach around their home. They're not necessarily wearing gloves, and then they're getting irritable and dry skin. So I guess it's about encouraging them to think about the products that they're using and the impact.
Absolutely. So if you're doing things which is slightly out of the ordinary and doing that regularly and coming into exposing your skin to chemicals, and that's something that need to think about if it's causing a skin. Could it be causing a skin problem? So just being aware of looking after your skin generally.
I'm conscious we're coming up to the break. Very quickly come round to the break, unfortunately, and I know we've got lots more to talk about. So inshallah, we're going to join you shortly after the break, inshallah, where we'll be able to continue the subject of skin, lumps and bumps. Inshallah, we'll see you in a short space of time. Assalamu alaikum.